what you see are just a lot of chatter now about the investments being made in the technology, about the people's curiosity about the technology. And, what we're seeing is that there's probably more discussion now about generative AI versus predictive AI. And that holds the hope really of addressing a lot of challenges, I think, historically that healthcare has faced. And right now, the majority of us are working under negative margins. And so we're really looking for that silver bullet or that solution to help, because we know we can't cut our way out of negative margins. So some of the traditional challenges we faced, and you can read about these in healthcare, I guess, for years past, are labor shortages and cost. We all talk about patient flow and the patient experience and how we get a lot of that friction out of the system. We really haven't beat that yet. We're managing healthcare equities and trying to make sure that our population is as healthy and we enable the care to the best of our abilities. And as I said before, healthcare is very complex. These challenges have not been solved, over the years. We're dealing with human lives and the quality of human lives. So we're excited about seeing how AI is being introduced into the market and people's enthusiasm over it. The conversations at the executive leadership team table really surround how we get alignment. They surround policies that may be required to help us better manage the technology as it evolves and gets more mature in the healthcare space. We're also hearing a lot of discussion with regard to caution, so that we're not reduplicating systems or solutions we already have. Or perhaps we're buying two AI solutions where we're recreating the days of the past where we had multiple healthcare applications to solve a single problem. And we tried to integrate everything together. And I think we all learned quickly that didn't work really well. So the conversations, again, kind of surround those areas in addition to alignment and moving forward adoption. I absolutely love the question of AI and how it's different perhaps from all the other hype cycles that we've seen in healthcare. And one of the things that I can say, it's probably the first time in years that I've really felt impassioned about a certain technology. I think we are on the verge of being able to finally address very long-standing challenges in this industry. When you take a look at the delivery now of 5G and the hyperconnectivity combined with AI and what it can do with data, we're finally there. So we've worked hard on building teams. We've worked hard on building foundations. We've worked hard on educating. And now I think we finally have this combined technology that can help us resolve a lot of these things that we've been struggling with for years. So I am hugely excited about this. I don't think it's just another hype cycle. I think this is reality for healthcare, and this may be the thing that really saves a lot of us and pulls us out of operating in these negative margins.